So the analysis of the influenza season in at-risk states was set to help healthcare providers best plan on when and where they should need more nurses helping in ICU units. So initially, we looked at a breakdown of the influenza season over 10 years, and we can see that across states throughout the US, that the most at-risk age groups are going to be these red and orange age groups, which account for almost all of the deaths of influenza throughout the season. We can also see that year by year, there doesn't seem to be a very distinct pattern as to which year is going to be worse. Some states will see that 2017 was worse than 2016. In other states, we'll notice a totally different pattern. So, in terms of the way the influenza pandemic is going to hit in the coming flu season, it's quite difficult to predict. So, we can't say for certain that it's going to be worse than the year before. This would be based on a lot of data that we currently don't have. So, we have to help hospitals plan using some other sort of patterns. In terms of vulnerable populations, as we mentioned, the most vulnerable is going to be 85 plus. These are people who probably already have some underlying health problems, and they are going to account for almost 50% of the deaths. And we can take a look at this pattern over a longer period, or we can take a look at it for just the past year. And no matter how we try and disaggregate this data, we see that it is relatively consistent. And if we look at the age groups combined of 75 plus and 85 plus, then we can see that this generally makes up about 75% of our deaths, and that any other age groups tend to differentiate depending on which state we're looking at, but that it's a much lower risk age group, so we don't need to be so concerned with these groups. But primarily people 75 plus should be very, very careful about their vaccinations. They should be very careful about washing their hands, and anybody around these people should also be very concerned about going around them if they show any symptoms of the flu. But also states that have a higher amount of these age groups, the 85 plus or the 75 plus, for example, Florida, should be much more concerned about the way that they treat the influenza season. In terms of season peaks, this may be the most important for most states. There are going to be just a few outliers that we're going to touch in the final slide. But in general, we can see these summer months where the weather is hotter and people are outside have quite low cases of deaths. Across the entire United States, we see around just under 3,000 deaths in general throughout almost that entire summer season, with a slight rise coming around October. Primarily, we could say that flu season starts in November. In some states, we see a lot higher rise, but that in December, that it's already very, very problematic. We're seeing double the number of deaths that we were seeing in August. A peak across the United States is in January with more than double what we were seeing in August, and the season goes all the way until April, with those early spring months being some of our worst ones. So healthcare providers should keep this in mind, that as early as November all the way until April, that entire 6-month period, they need to be thinking about who is going to be manning the hospitals. Primarily December, January, and February are going to be the highest peak months. We should be looking at having almost double the ICU staff that would be working with influenza patients just across the board. And probably keeping staff on call during these months, as state by state we will notice in the next slide that there is